Good morning, everyone. Okay, I will talk about virtual clinic and nurse practitioner. An advanced practitioner nurse, she needs at the minimum requirement as a master's degree in advanced practice field. The role were developed in 1960s in response to unmet healthcare needs, particularly in the rural area where primary care physicians were lacking. The role of advanced practitioner nurse can be widely varied. It depends on the institution and her regulation. As the APRN scope of practice, we start with the clinical. As clinical, we have inpatient and outpatient. Inpatient, the heart failure transplant APNs attend around daily, make contribution to patient care. This includes a daily physical assessment of the patient, a medication review adjustment, and a discharge planning. She can initiate and interpret the workup and evaluate along with the consult candidacy for candidate transplant or LVAD. She can be part of the consultation, and she is a part of the selection committees. As an outpatient, the APN obtains a focus history, reviews medication, examines patient, review diagnostic, and formulate a plan of care that is then reviewed by the attending physician. She can prescribe medication. She can put the GDMT and lifestyle medication plan for the patient. She can give education to patient and the family, and she can order diagnostic procedure. As an educator, she has to educate about the importance of GDMT and the change of lifestyle. NP can provide extensive family education about transplant workup and listing process and the unified SCOT waiting list. She can help potential recipients and their family to comprehend the process of transplantation. Once the patient has been listed, the operative teaching may be completed over months, weeks, or days. It depends on the patient status at the time of listing. In service, she can give in service to the resident and to the nurses. As a researcher, she can participate and contribute to the research activity of the center, including participating as primary investigator, data collection, dissemination, and reporting. She can recruit patients for the clinical trials. As a quality improvement, she can implement evidence-based practice in the hospital, and she can be awareness of the hospital policy and procedure. The impact of the role of APN in the heart failure field. Patients managed by APN and in a heart failure clinic have fewer unnecessary hospital readmission, fewer potential preventable hospitalization, higher patient satisfaction, and fewer unnecessary emergency room visits. She works with patients in order to support compliance with and adherence to the prescribed treatment and provide information and advice for better lifestyle in case they deteriorate to lead them to the advanced therapy as heart transplant or mechanical support. Virtual clinic. The healthcare system is evolving at a rapid pace as healthcare providers look for ways to increase healthcare quality and accessibility while decreasing the overall cost. A virtual clinic is a digital technology that allows remote and real-time interaction between patient and the doctor through phone or video calls for diagnostic, examination, and medical assessment. It can help to facilitate or maximize the quality and effectiveness of patient care. Virtual clinic can facilitate safe and rapid uptitration of the GDMT. She can improve patient outcome measures and prevent for heart failure-related hospitalization. This approach mitigates system-based challenges. It can include staff shortage, limited follow-up, and decreased continuity of care. As telemedicine and remote monitoring significantly influence cardiology by improving patient care and outcome by harnessing technology to enhance remote monitoring, diagnostic, and communication between healthcare providers. Remote monitoring provides more than the communication of health data via remote connection. In King Faisal, we started the invasive and then the non-invasive and then the invasive telemonitoring in our hospital. So the non-invasive was started in 2016. We used to give a weight scale, pulse oximeter, and a blood pressure machine to the patient. But unfortunately, this non-invasive monitoring was not that successful because we used to receive data for the family member. The invasive one, it's the implementing of a sensor to the pulmonary artery who will give us the hemodynamic of the patient. The role of heart failure nurse in telemedicine, especially in cardiomems. Heart failure telemedicine can eliminate barrier to care such as travel burden and child care. She can improve continuity and coordination through increased point of contact. She can facilitate patient engagement and improve healthcare outcome. In case any critical results like high PA pressure or high heart rate, patient will be contacted and managed by medication titration as diuretic, and then they will be asked to send us a lab investigation, especially renal profile. We can arrange with pharmacy to deliver the medication for the patient at home, and if in case we need it, we can arrange for an admission. CardioMEMS at King Faisal experience. It was launched in October 2021. Up to date, we have 126 patients with CardioMEMS. 5 of them are heart transplanted now, 15 of them are on VAD, and the other are just waiting. We got, the study was done for after 1 year, 6 months to 1 year implantation of the MEMS, 41 reduction in the heart failure readmission. 4 of the patients were removed from the heart transplant list. In summary, MP role imposed significant benefits during pre and post-advanced heart failure management. MP care in heart failure can be shown to reduce readmission, improve timeless of visit, decrease cost, and improve quality outcome in small heterogeneous study. Key of success of MP care is the bond they create between patient, family, and the caregiver. Virtual clinic and telemonitoring, it's safe, reliable, and proven clinically effective strategy to prevent heart failure, rehospitalization, and improve quality of life and cost effective. Thank you.